Good day everyone. So my name is John Ryan S. Bako. I'm from BSN 1C and today I am going to discuss about the male and female genitalia and also the rectum. So first let us go with the male genitalia and rectum structures and also its function. This is to assess the external and the internal male genitalia, the anus, rectum, and the prostate. A basic understanding of normal structure and functions of this area are very necessary. This understanding helps us to guide the physical examination and readily assess the examiner in identifying abnormalities. So first, let us go deeper with the external and the internal genitalia. So first is the external genitalia. The external genitalia consists of the penis and the scrotum. So the penis is the male reproductive organ attached to the pubic area by ligaments. The penis is freely movable. So the shaft of the penis is composed of the three cylindrical masses of vascular erectile tissue that are bound together by fibrous tissue. So, two corpora cavernosa on the dorsal side and the corpus spongiosum on the ventral side. So, the corpus spongiosum extends distally to form the acorn-shaped glands. The base of the glands or corona is somewhat larger as compared to the shaft of the penis. So, a hood-like fold of skin called the foreskin or rubus covers the glands. In the center of the corpus spongiosum is the urethra, which travels through the shaft and opens as a slit at the tip of the glands as the urethral meatus. So, the penis has a role in both reproduction and urination. So, next is the scrotum. So, the scrotum is a thin-walled sac that is suspended below the pubic bone, posterior to the penis. So, this darkly pigmented structure contains sweat and sebaceous glands and consists of folds of skins and the cremaster muscle. So, the scrotum function as a protective covering for the testes. Um, Also, the epididymis and the vas deferens and helps to maintain the cooler than body temperature necessary for production of the sperm, which is less than 37 degrees Celsius. So now let's go to the internal genitalia. So the internal genitalia is composed with the testes and the spermatic cord. So first is the testes. So the testes are a pair of ovoid-shaped organs similar to the ovaries in the woman that are approximately 3.7 to 5 centimeters long, 2 centimeters wide, and 2 centimeters deep. So each testis is covered by a serous membrane called the tunica vaginalis, so which separates the testes from the scrotal wall. So the tunica vaginalis is double layered and lubricated to protect the testes from injury. The function of the testes is to produce spermatozoa and the male sex hormone called the testosterone. So next is the spermatic cord. So the spermatic cord contain blood vessels, lymphatic vessels, nerves, and the vas deferens or ductus deferens which transports spermatozoa away from the testes. So the spermatic cord on the left side is usually longer, thus the left testis hangs lower than the right testis. So the epididymis is a comma-shaped, coiled, tubular structure that curves up the upper and the posterior surface of the testes. It is within the epididymis that the spermatozoa mature. Now, the vas deferens is a firm, muscular tube that is continuous with lower portion of the epididymis. The vas deferens provides the passage for transporting sperm from the testes to the urethra for ejaculation. Along the way, secretions from the vas deferens, seminal vesicle, prostate gland, and the cowpers or the bulbourethral gland mix with the sperm and form semen. So the inguinal area. So the inguinal area is contained between the anterior superior iliac spines laterally and the symphysis pubis medially. So the external inguinal ring is the exterior opening of the inguinal canal, which can be palpated above and lateral to the symphysis pubis. It feels triangular and slit-like. The internal inguinal ring is the internal opening of the inguinal canal. It is located to 1 to 2 centimeters above the midpoint of the inguinal ligament and cannot be palpated. The femoral canal is another potential spot for a hernia. The femoral canal is also located posterior to the inguinal canal and medial to and running parallel with the femoral artery and vein. So when assessing the male genitalia, the nurse needs to be familiar with the structure of the inguinal or groin area because hernias, protrusion of loops of bowel through weak areas of the musculature are common in this location. Next is the anus and rectum. So the anal canal is the final segment of the digestive system. It begins at the anal sphincter and ends at the anorectal junction. Within the anus are the two sphincters that normally hold the anal canal closed except when passing gas and feces. The external sphincter is composed of skeletal muscle and is under voluntary control. The internal sphincter is composed of smooth muscle and is under involuntary control by the autonomic nervous system. Dividing the two sphincter is the palpable and the intersphincteric groove. So the anal canal proceeds upward toward the umbilicus. Just above the internal sphincter is the anorectal junction, the dividing point of the anal canal and the rectum. The rectum is lined with folds of mucosa known as the columns of Morgani. So the anorectal junction is not palpable but may be visualized during the internal examination. The anal canal and rectum are approximately right angle to each other. The inside of the rectum contains three inward foldings called the valves of Houston. So the function of the valves of Houston is unclear. Next is the prostate. So the prostate gland is approximately 2.5 to 4 centimeters in diameter, surrounding the neck of the bladder and urethra. It lies between these structures and the rectum in male clients. So the prostate gland consists of two lobes separately by a shallow groove called the median sulcus. So it secretes a thin milky substance that promotes sperm motility and neutralizes female acidic vaginal secretion. So let's move on to the male genitalia and rectum health assessments. So health assessment, collecting subjective data, the nursing health history. So when interviewing the male client for information regarding his genitalia, anus, and rectum, and also the prostate, keep in mind that this may be a very sensitive topic and can prove to be embarrassing for both the client and the examiner. So moreover, the examiner should be aware of his or her own feelings regarding body image, fear of cancer, and sexuality. Anxiety, embarrassment, and fear may be influence the client's ability to discuss problems and ask questions. So therefore, it is important to ease the client's anxiety as much as possible. So first is the history of the present health concern. So first is the pain. So do you have, by asking, do you have pain in your penis, scrotum, testes, or groin? Complaints of pain in these areas may indicate a hernia or an inflammatory process such as epididymitis. So next is lesion. So have you noticed any lesions on your penis or genital area? If so, do the lesion itch, burn, or sting? Please describe the lesion. So lesions may be a sign of sexual transmitted infection or STI or cancer. Next is discharge. So by asking, have you noticed any discharge from your penis? If so, how much? So what color is it? So what type of odor does it have? So discharge may indicate an infection. Next is the lump, swelling, masses, especially of urination, sexual dysfunction, bowel patterns, stool, and itching and pain. Next is the past health history. So, by asking, when was the last time you had a testicular examination by a physician? What was the result? So, most physicians agree that an examination of a man's testicles should be part of the general physical examination. So, the ACS recommends a testicular exam as part of a routine cancer-related checkup. Next is to describe any prior medical problems you have or you have had, how they were treated, and the results. So prior to these problems directly affect the physical assessment finding. For example, if cancer was present in the past, it may recur. So diabetes and some hypertensive medication may cause impotence. So now let's proceed to the family history. So by asking, is there a history of polyps or colon, rectal or prostate cancer in your family? So colorectal cancer risk is increased by a family history of colorectal cancer and or polyps. So genetic study also suggests that a strong family history may be responsible for 5 to 10% prostate cancers. So next is the lifestyle and health practices. So by asking, how many sexual partners do you have? So a client with multiple sexual partners increases his risk of contracting an STI or HIV. So next is by asking, have any anal have any anal or rectal problems affected your normal activities of daily living, working or engaging in recreation? So some problems such as the hemorrhoids or bowel incontinence may affect a client's ability to work or interact socially. So now let's proceed to the next slide, which is the collecting objective data physical examination. So the purpose of examining the male genitalia is to detect abnormalities that may range from life-threatening disease to painful conditions that interfere with normal function. So abnormalities should be detected as early as possible so that the client can be referred for further testing or treatment. So for the penis, so inspect the base of the penis and the pubic hair. So note pubic hair growth pattern and any excoriation, erythema, or infestation at the base of the penis and within the pubic hair. So for the normal findings, pubic hair is coarser than the scalp hair. The normal pubic hair pattern in adult is hair covering the entire groin area, extending to the medial thighs and up the abdomen towards the umbilicus. So the base of the penis and the pubic hair are free of excoriation, erythema, and infestation. So for abnormal findings, absence or scarcity of pubic hair may be seen in clients receiving chemotherapy. Lice or nit or eggs infestation at the base of the penis or pubic hair is known as the pediculosis pubis. This is commonly referred to as crabs. Next is to inspect the skin of the shaft. So observe rashes, lesions, or lumps. So for the normal findings, the skin of the penis is wrinkled and hairless and is normally free of rashes, lesions, or lumps. Genital piercing is becoming more common and nurses may see male clients with one or more piercings of the penis. So for abnormal findings, rashes, lesions, or lumps may indicate STI or cancer. Drainage around the piercing indicates infection. Next is to palpate the shaft. Palpate any abnormalities noted during inspection. Also note any hardened or tender areas. Next is for the normal findings, the penis is non-erect state is usually soft, flaccid, and non-tender. For the abnormal findings, tenderness may indicate inflammation or infection. So, inspect the foreskin. So, observe for color, location, and integrity of the foreskin in uncircumcised men. So, for the normal findings, the foreskin which covers the glands is in an uncircumcised male client is intact and uniform in color with the penis. For abnormal findings, discoloration of the foreskin may indicate scarring or infection. Inspect the glands. So, observe for size, shape, and lesion or redness. So, for the normal findings, the gland size and shape vary, appearing rounded, broad, or even pointed. The surface of the gland is normally smooth, free of lesion and redness. So, for abnormal findings, cancres, red oval ulceration from syphilis, genital warts, and painful like lesion from herpes are sometimes detected on the glands. Palpate for urethral discharge. So gently squeeze the glands between between your index finger and the thumb. For the normal findings, the urinary meatus is normally free of discharge, while for the abnormal findings, a yellow discharge is usually associated with gonorrhea. So, a clear or white discharge is usually associated with urethritis. Any discharge should be cultured. So, inspection and palpation scrotum. So, inspect the size, the shape, and position of the scrotum. So, observe for swelling, lumps, or bulges. So, for the normal findings, the scrotum varies in size according to temperature and shape. The scrotal sac hangs below or at the level of the penis. The left side of the scrotal sac usually hangs lower than the right side. So for abnormal findings, an enlarged scrotal sac may result from fluid or the hydrocele, blood or the hematocele, bowel hernia or tumor or the cancer. So palpate the scrotal content. So palpate each testis and epididymis between your thumb and first two fingers. So note size, shape, consistency, nodules, masses, and tenderness. So for the normal findings, testes are ovoid and equally bilaterally in size and shape. They are smooth, firm, rubbery, mobile, free of nodules, and rather tender to pressure. So the epididymis is non-tender, smooth, and softer than the testis. So for the abnormal findings, absence of a testis suggests cryptorchidism, so an undescended testicle. Painless nodules may indicate cancer. Tenderness and swelling may indicate acute or orchitis torsion of the spermatic cord, strangulated hernia, or epididymitis. So, if the client has epididymitis, the passive elevation of the testes may relieve the scrotal pain or the Bren sign. So, inspection and palpation of inguinal area. So, inspect for inguinal and femoral hernia. Inspect the inguinal and femoral areas for bulges. Then ask the client to turn head and cough or to bear down as if having a bowel movement, and continue to inspect the areas. So, for the normal findings is that the inguinal and femoral areas are normally free from bulges. So, for the abnormal findings, bulges that appear are at the external inguinal ring or at the femoral canal when the client bears down may signal a hernia. So, palpate for inguinal hernia and inguinal nodes. So, for the normal findings, bulging or masses are not normally palpated. For the abnormal findings, a bulge or mass may indicate a hernia. Palpate inguinal lymph nodes. So, if nodes are palpable, note size, consistency, mobility, or the tenderness. So, for the normal findings, no enlargement or tenderness is normal. For abnormal findings, enlarged or tender lymph nodes may indicate an inflammatory process or infection of the penis or the scrotum. Palpate for femoral hernia. So, palpate on the front of the thigh in the femoral canal area. Then ask the client to bear down or cough. Feel for bulges. Repeat on the opposite thigh. So, for the normal findings, bulges or masses are not normally palpated. For the abnormal findings, bulge or mass palpated as clients bear down or coughs. Inspection and palpation of anus and rectum. So, inspect the perineal area. So, inspect the perineal area, spread the client's buttocks, and inspect the anal opening and surrounding area for the following lumps, ulcers, lesions, rashes, redness, fissures, and the thickening of the epithelium. So, for the normal findings, the anal opening should appear hairless, moist, and tightly closed. So, the skin around the anal opening is more coarse and more darkly pigmented. So, the surrounding perineal area should be free of redness, lumps, ulcers, lesions, and rashes. So, for the abnormal findings, lesions may indicate STIs, cancer, or hemorrhoids. So, thrombus external hemorrhoid appears swollen. It is itchy, painful, and bleeds when the client passes stool. So, painful mass that is hardened and reddened suggests perineal abscess. So, a swollen skin tag on the anal margin may indicate a fissure in the anal canal. Redness and excoriation may be from scratching an area infected by fungi or pinworms. So, a small opening in the skin that surrounds the anal opening may be an anorectal fistula. So, palpate the anus. So, inform the client that you are going to perform the internal examination. So, at this point, explain that it may feel like his bowels are going to move, but this will not happen. So, lubricate your glove, index finger as the client to bear down. So, for the normal findings, client's sphincter relaxes, permitting entry. So, for the abnormal findings, sphincter tightens, making further examination unrealistic. Palpate the rectum. So, insert your finger further into the scrotum as far as possible. Next, turn your hand clockwise, then counterclockwise. This allows palpation of as much rectal surface as possible. No tenderness, irregularities, nodules, and hardness. So, for the normal findings, the rectal mucosa is normally soft, non-tender, and free of nodules. So, for the abnormal findings, hardness and irregularities may be from scarring or cancer. Nodules may indicate polyps or cancer. So, palpate the peritoneal cavity. This area may be palpated in the men above the prostate gland in the area of the seminal vesicles on the anterior surface of the rectum. No tenderness or nodules for the normal. For the normal findings, this area is normally smooth and non-tender. For the abnormal findings, peritoneal protrusion into the rectum called the rectal shelf may indicate cancerous lesions of peritoneal metastasis. Tenderness may indicate peritoneal inflammation. Palpate the prostate gland. So, note the size, shape, and consistency of the prostate and identify any nodules or tenderness. So for the normal findings, the prostate is normally non-tender and rubbery. It has two lateral lobes that are divided by a median sulcus. So the lobes are normally smooth, 2.5 centimeters long and heart-shaped. So for the abnormal findings, a swollen tender prostate may indicate acute prostatitis, an enlarged smooth, firm, slightly elastic prostate that may not have median sulcus suggests benign prostatic hypertrophy. So, hard area on the prostate or hard, fixed, irregular nodules on the prostate suggests cancer. Check stool. So, inspect the stool. Inspect any fecal matter on your gloves. Then assess the color and test the vessels for occult blood. So, provide the client with a towel to wipe the anorectal area. So, for the normal findings, stool is normally semi-solid, brown, and free of blood. So, for the abnormal findings, black stool may indicate upper gastrointestinal bleeding. Gray or tan stool results from the lack of bile pigment, and yellow stool suggests steatorrhea. It is an increased fat content. So, blood detected in the stool may indicate cancer of the rectum or colon. So, refer to the client for an endoscopic examination of the colon. So the abnormal findings, the abnormalities of the penis. So herpes progenitalis, clusters of pimple-like clear vesicles that erupt and become ulcers, painful initial lesions of this STI typically caused by HSV1 or the HSV2 disappear and the infection remains dormant for varying periods of time. Recurrences can be frequent or minimally episodic. So phimosis, foreskin is so tight that it cannot be retracted over the glands. So abnormalities of the scrotum. So orchitis, inflammation of the testes associated frequently with mumps. Client complains of pain, heaviness, and fever. Scrotum appears enlarged and reddened. Swollen tender testis is palpated. So the examiner may have difficulty differentiating between the testis and the epididymis. Next is the varicocele. So abnormal dilation of veins in the spermatic cord. Client may complain of discomfort and testicular heaviness. Tortuous veins are palpable and feel like a soft, irregular mass or bag worms. So which collapse when the client is supine. So infertility may be associated with this condition. So abnormalities of the inguinal and the femoral hernias. So femoral hernia, bowel herniates through the femoral ring and canal. It never travels into the scrotum and the inguinal canal is empty. This is the least common type of hernia. It occurs mostly in women. Abnormalities of the anus and rectum. So rectal cancer, a rectal carcinoma is usually asymptomatic until it is quite advanced. Thus, routine rectal palpation is essential. So a cancer of the rectum may feel like a firm nodule, an ulcerated nodule with rolled edges, or as it grows, a large, irregularly shaped, fixed, hard nodule. Cancer of the prostate. So, a hard area on the prostate or hard, fixed, irregular nodules on the prostate suggests cancer. The median sulcus may not be palpable. So now let's go to the female genitalia and rectum structures and functions. So in order to perform an adequate assessment of the female genitalia, anus, and rectum, The examiner must have a knowledge base of the structure and function of the female genitalia, specifically the external and the internal structures, and the anus and also the rectum. So first is the external genitalia. So the external genitalia include those structures that can be readily identified through inspection. So the mons pubis is the fat pad located over the symphysis pubis. The normal adult mons pubis is covered with a pubic hair in a triangular pattern. It functions to absorb force and to protect the symphysis pubis during the coitus or sexual intercourse. Next is the labia majora. These are two folds of skin that extend posteriorly and inferiorly from the mons pubis to the perineum. The skin folds are composed of adipose tissue, sebaceous glands, and sweat glands. The outer surface of the labia majora is covered with the pubic hair in the adult, whereas the inner surface is pink, smooth, and moist. Inside the labia majora are the thinner skin folds of the labia minora. These folds join anteriorly at the clitoris and form a prepuce or hood. Posteriorly, the two folds join to form the frenulum. Compared with the labia majora, the labia minora are hairless and usually darker pink. They contain numerous sebaceous glands that promote lubrication and maintain a moist environment in the vaginal area. Next is the clitoris. It is located at the interior end of the labia minora. It is a small cylindrical mass of the erectile tissue and nerves with three parts: the glans, the corpus, and the crura. So the glans is the visible rounded portion of the clitoris. The clitoris is similar to the male penis and contains many blood vessels that become engorged during sexual arousal. So the skin folds of the labia majora and the labia minora form a boat-shaped areas or the fossa called the vestibule. So the vestibule contains several openings located between the clitoris and the vaginal um, orifice is the urethral meatus. The opening of the skin gland are located on either side of the urethral opening and are usually not visible. So, skin glands secrete mucus that lubricates and maintains a moist vaginal environment. These small glands are often referred to as the lesser vestibular glands. Below the urethral meatus is the vaginal orifice. So this is the external opening of the vagina and has either a slit-like or irregular circular structure depending on the configuration of a hymen. The hymen is a fold of membranous tissue that covers the part of the vagina. So on the other side of and slightly posterior to the vaginal orifice between the vaginal and orifice and the labia minora are the openings to Bartholin's glands. So these glands secrete mucus which lubricates the area during sexual intercourse. So these small glands, which are not visible to the naked eye, are often referred to as the greater vestibular glands. The internal genitalia. So the internal genitalia structures function as the female reproductive organs. It includes the vagina, the cervix, the uterus, the fallopian tubes, and the ovaries. So first is the vagina. It is a muscular tubular organ, extends up and slightly back towards the rectum from the vaginal orifice, external opening to the cervix. So the vagina performs many functions. It allows the passage of menstrual flow, receives the penis during sexual intercourse, and serves as the lower portion of the birth canal during delivery. So the vaginal wall comprises of four layers. The outer layer, it is composed of pink squamous epithelium and connective tissue. It is under the direct influence of the hormone estrogen and contains many mucus producing cells. Next is the next second layer is the submucosal layer. It contains the blood vessels, nerves, and the lymphatic channels. Um, the third layer is composed of a smooth muscle, and the fourth layer consists of the connective tissue and the vascular network. So the normal vaginal environment is acidic. This environment is maintained because the vaginal flora is composed of the doderlines, bacilli, and the bacilli act on the glycogen to produce lactic acid. This acidic environment helps to prevent vaginal infection. So in the upper end of the vagina, the cervix dips down and forms a circular recess that gives rise to areas known as the anterior and the posterior fornices. So the cervix is composed of the smooth muscle, muscle fibers, and connective tissue. So the cervix function is to allow the entrance of sperm into the uterus and to allow the passage of menstrual flow. It also secretes mucus and prevents the entrance of vaginal bacteria. During childbirth, the cervix stretches or dilates to allow the passage of the fetus. So the uterus is a pear-shaped muscular organ that has two components, the corpus or body and the cervix or the neck. Um, so the corpus of the uterus is divided into the fundus, the upper portion, and the body, which is the central portion, and the isthmus, the narrow lower portion. So the uterus is usually situated in the forward position above the bladder at approximately 45 degrees angle to the vagina. When standing, anteverted and anti-flexed position. So the normal size uterus is approximately 7.5 centimeters long, 5 centimeters wide, and 2.5 centimeters thick. The uterus is movable. So the ovaries are a pair of small oval-shaped organs, each of which is situated on a lateral aspect of the pelvic cavity. So each is approximately 3 centimeters long, 2 centimeters wide, and 1 centimeters deep. So the ovaries are connected to the uterus by the ovarian ligament. So the ovary function is to develop and release ova and to produce hormones such as the estrogen, the progesterone, and the testosterone. So the ovum travels from the ovary to the uterus through the fallopian tubes. These 8 to 12 centimeters long tubes begin near the ovaries and enter the uterus just beneath the fundus. The ends of the tube near the ovaries has fringe-like extension called the fimbriae. So the ovaries, fallopian tubes, and supporting ovarian ligaments are referred to as the adnexa, or the Latin for the appendages. Next is the anus and the rectum. So the anal canal is the final segment of the digestive system. It begins at the sphincter and ends at the anorectal junction. It measures from 2.5 centimeters to 4 centimeters long. It is lined with skin that contains no hair or sebaceous glands, but does contain many somatic sensory nerves, making it susceptible to pain stimuli. The anal opening or anal verge can be distinguished from the perineal skin by its hairless, moist appearance. So the anal verge extends interiorly, overlying the external anal sphincter. Within the anus are the two sphincters that normally hold the anal canal closed except when passing gas and feces. So the external sphincter is composed of skeletal muscle and is under voluntary control. The internal sphincter is composed of smooth muscle and is under involuntary control by the autonomic nervous system. So dividing the two sphincters is the palpable intersphincteric groove. So the rectum is the lowest portion of the large intestine and is approximately 12 centimeters long, extending from the end of the sigmoid colon to the anorectal junction. So the anal canal and the rectum are at approximately right angles to each other. So the inside of the rectum contains three inward foldings called the valves of Houston. The functions of the valve Houston is unclear. Female genitalia and the rectum health assessments. Collecting subjective data. So when interviewing the client about genital, reproductive, anal, and rectal health, keep in mind the sensitivities of the client as well as your own feelings regarding sa body image, fear of cancer, sexuality, and the like. So ask the questions in a straightforward manner and let the client voice any concerns throughout the assessment. So anxiety, embarrassment, and fear may affect the client's ability to discuss the problems and ask questions. So because some problems can be serious or even life-threatening, it is important to establish a trusting relationship within the client because the information gathered during the subjective examination may suggest a problem or point to the possibility of a problem developing. Excuse. Um, so first is the history of the present health concern. So menstrual cycle. So we can ask, what was the date of your last menstrual period? Do your menstrual cycles occur on a regular schedule? How long do they last? Describe the typical amount of blood flow you have with your period. Any clotting? So a normal menstrual cycle usually occurs approximately every 18 to 45 days. So the average length of menstrual blood flow is 3 to 7 days. The absence of menstruation, excessive bleeding, or a marked change in menstrual pattern indicates a need to collect more information. So next is the menopause. So we can ask, are you experiencing any symptoms of the menopause? So hormone fluctuation impacts vasomotor instability, resulting in symptoms. So about 60% of menopausal women experiences hot flashes and night sweats. So mood swings, decreased appetite, vaginal dryness, spotting, and irregular vaginal bleeding may also occur. So next is the vaginal discharge, pain, and masses. We can ask, are you experiencing vaginal discharge that is unusual in terms of color, amount, and or odor? So vaginal discharge may be from an infection. Next is we can ask, do you have any lumps, swelling, or masses in your genital area? So these findings may indicate infection of lymphedema or cancer. Excuse. So past occurrences should be monitored for recurrence. Next is sexual dysfunction, specifically urination, bowel patterns, stool, and itching and pain. Next is personal health history. We can ask, have you been diagnosed with diabetes? So diabetes predisposes women to vaginal yeast infections. Next is we can ask, have you ever been pregnant? Um, how many times? So how many children do you have? Is there any chances that you might be pregnant now? Any miscarriages or abortions? So the female client's ability to become impregnated and carry a fetus to term is important baseline information. It is important to know if the client is pregnant in case a medication or x-ray test needs to be prescribed. Next is the lifestyle and health practices. So we can ask, how many sexual patterns do you have? So a client who has multiple sexual patterns increases her risk of contracting STIs. Next is we can ask, do you wear cotton underwear and avoid tight jeans? So cotton allows air to circulate. Nylon and tight-fitting jeans create a moist environment which promotes vaginal yeast infections. Collecting objective data. So the physical examination of the female genitalia, anus, and rectum may create client anxiety. The client may be embarrassed about exposing her genitalia and nervous that an infection or disorder will be discovered. Be sure to explain in detail that you will be doing throughout the examination, and to explain the significance of each portion of the examination. Make sure to encourage the client to ask questions. So, inspection and palpation. First, let's go first to the external genitalia. So, inspect the mons pubis, wash your hands, and put on gloves. As you begin the examination, note the distribution of the pubic hair. Also, be alert for signs of infestation. Next is for the normal findings. Pubic hair is distributed in an inverted triangular pattern, and there are no signs of infestation. For the abnormal findings, absence of pubic hair in the adult client is normal. Lice or nits or eggs at the base of the pubic hair indicates infestation with the pediculosis pubis. This condition, commonly referred to as crabs. It is most often transmitted by sexual contact. Observe and palpate inguinal lymph nodes. So for the normal findings, there should be no enlargement or swelling of the lymph nodes. On the other hand, for the abnormal findings, enlarged inguinal nodes may indicate a vaginal infection or may be the result of irritation from shaving the pubic hairs. Inspect the labia majora and the perineum. So observe the labia majora and perineum for lesions, swelling, and excoriation. So for the normal findings, the labia majora are equal in size and free of lesion, swelling, and excoriation. So healed tear or episiostomy scar may be visible on the perineum if the client has a given birth. So the perineum should be smooth. So for the abnormal findings, lesions may be from an infection disease such as herpes or syphilis. So excoriation and swelling may be from scratching or self-treatment of the lesions. Evaluate all lesions and refer the client to a primary care provider for treatment. Inspect the labia minora, the clitoris, urethral meatus, and the vaginal opening. So use your gloved hand to separate the labia majora and inspect for lesion, excoriation, swelling, and or discharge. So for the normal findings, the labia minora appears symmetric, dark, pink, and moist. The clitoris is a small amount of erectile tissue sensitive to touch. The normal size of the clitoris varies. So the urethral meatus is small and slit-like. The vaginal opening is positioned below the urethral meatus. So its size depends on sexual activity or vaginal delivery. A hymen may cover the vaginal opening partially or completely. So for the abnormal findings, asymmetric labia may indicate abscess, lesion, swelling, bulging in the vaginal opening, and discharge are abnormal findings. Excoriation may result from the client scratching or self-treating perineal irritation. Palpate the Bartholin's gland. So, if the client has labial swelling or a history of it, palpate Bartholin glands for swelling, tenderness, and discharge. So, for the normal findings, Bartholin's glands are usually soft, non-tender, and drainage-free. For the abnormal findings, swelling, pain, and discharge may result from infection and abscess. If you detect a discharge, obtain a specimen to send to the laboratory for culture. Palpate the urethra. So if the client reports urethral symptoms or urethritis, or if you suspect inflammation of skin glands, insert your glove index finger into the superior portion of the vagina and milk the urethra from the inside, pushing up and down, up and out. So for the normal findings, no drainage should be noted from the urethral meatus. The area is normally soft and non-tender. For the abnormal findings, drainage from the urethra indicates possible urethritis. Any discharge should be cultured. Urethritis may occur with infection with Neisseria, gonorrhea, or the chlamydia trachomatis. Next is the inspection of the internal genitalia. So inspect the size of the vaginal opening and the angle of the vagina. So for the normal findings, the normal vaginal opening areas in size, according to the client's age, sexual history, and whether she has given birth vaginally, the vagina is typically tilted posteriorly at a 45-degree angle and should feel moist. Um, for the normal findings, a condition in which the vagina becomes thinner and drier is vaginal atrophy. So this occurs when the body lacks estrogen. So some causes may include menopause, breastfeeding, surgical removal of the ovaries, and the cancer treatments. So the risk increases if you smoke or with the absence of vaginal birth. Any loss of hymenal tissue between the 3 o'clock position and the 9 o'clock position indicates trauma. So, penetration by digits, penis, or the foreign objects in children. Next is to inspect the vaginal musculature. So, keep your index finger inserted in the client's vaginal opening. Ask the client to squeeze around your finger. So for the normal findings, the client should be able to squeeze around the examiner's finger. Typically, the nulliparous women can squeeze tighter than the multiparous woman. So no bulging and no urinary discharge. So for the normal findings, absent or decreased ability to squeeze the examiner's finger indicates decreased muscle tone. So decreased tone may decrease sexual satisfaction. So bulging of the anterior wall may indicate cytocele. Bulging of the posterior wall may indicate a rectocele. If the cervix or urethra protrudes down, the client may have uterine prolapse. If urine leaks out, the client may have stress incontinence. Inspect the cervix. So observe cervical color, size, and position. So for the normal findings, the surface of the cervix is normally smooth, pink, and even. Normally, it is midline in position and projects 1 to 3 centimeters into the vagina. In pregnant clients, the cervix appears blue or Chadwick's sign. So for the abnormal findings, in a non-pregnant woman, a blue cervix may indicate a cyanosis. In a non-menopausal women, a pale cervix may indicate anemia. Redness may be from inflammation. Asymmetric redness, reddened areas, strawberry spots, and white patches are also abnormal. So cervical lesions may result from polyps, cancer, or infection. Cervical enlargement or projection into the vagina more than 3 centimeters may be from prolapse or tumor. And further evaluation is needed. Inspect the vagina. So note the vaginal color, surface, consistency, and any discharge. So for the normal findings, the vagina should appear pink, moist, smooth, and free of lesions and irritation. It should be free of any colored or malodorous discharge. So for the abnormal findings, reddened areas, lesions, and colored malodorous discharge are abnormal and may indicate vaginal infections, STIs, or cancer. Altered pH may indicate infection. Inspection and palpation of anus and rectum. So inspect the perineal area. Inspect the perineal area by spreading the client's buttocks and inspect the anal opening and surrounding area. So for the following lumps, ulcers, lesions, rashes, redness, fissures, or thickening of the epithelium. So for the normal findings, the anal opening should appear hairless, moist, and tightly closed. So the tightly skin around the anal opening is more coarse and more darkly pigmented. The surrounding perineal area should be free from redness, lumps, ulcers, lesions, and rashes. So for the abnormal findings, lesions may indicate STIs, cancer, or hemorrhoids. So a thrombosed external hemorrhoid appears swollen. It is itchy, painful, and bleeds when the client passes stool. So a painful mass that is hardened and reddened suggests a perineal abscess. So a swollen skin tag on the anal margin may indicate a fissure in the anal canal. So redness and excoriation may be from scratching an area infected by fungi or pinworms. So a small opening in the skin that surrounds the anal opening may be an anorectal fistula. Inspect the sacrococcygeal area. Inspect this area for any signs of swelling, redness, dimpling, or hair. So for the normal findings, area is normally smooth and free of redness and hair. For the abnormal findings, a red and swollen or dimpled area covered by a small tuft of hair located midline on the lower sacrum suggests a pilonidal cyst. Palpate the anus. So inform the client that you are going to perform the internal examination at this point. Explain that it may feel like her bowels are going to move, but this will not happen. So for the normal findings, client sphincter relaxes, permitting entry. For the abnormal findings, sphincter tightens, making further examination unrealistic. Palpate the rectum, so note tenderness, irregularities, nodules, and hardness. So for the normal findings, the rectal mucosa is normally soft, smooth, non-tender, and free of nodules. For the abnormal findings, hardness and irregularities may be from scarring or cancer. Nodules may indicate polyps or cancer. Palpate the cervix through the anterior rectal wall. So for the normal findings, cervix palpated a small round mass. May also palpate tampon or retroverted uterus. Should not have any bright red blood when gloved finger is removed. For the abnormal findings, bright red blood on gloved finger when removed. Large mass palpated. Do not mistake tampon for mass. Check stool. So inspect the stool, assess the color, and test the feces for occult blood. Provide the client with a towel to wipe the anorectal area. So for the normal findings, stool is normally semi-solid, brown, and free of blood. For the abnormal findings, black stool may indicate upper gastrointestinal bleeding. Gray or tan stool results from the lack of bile pigment, and yellow stool suggests steatorrhea or an increased fat content. Blood detected in the stool may indicate cancer of the rectum or colon. Then refer the client for an endoscopic examination of the colon. Next is abnormal findings or the abnormalities of the external genitalia and vaginal opening. So when assessing the female genitalia, the nurse will see various abnormal lesions on the external genitalia as well as abnormal bulging in the vaginal opening. Some common findings follow. So first is the syphilitic canker. So syphilitic cankers often first appear on the perineal area, silvery white papules that become superficial red ulcers. Syphilitic cankers are painless. They are sexually transmitted and usually develop at the site of initial contact with the infecting organism. Next is the genital warts. So genital warts caused by the human papilloma virus or the HPV are moist, fleshy lesions on the labia and within the vestibule. They are painless and believed to be sexually transmitted. Abnormalities of the cervix. First is the mucopurulent cervicitis. So, this condition produces a mucopurulent yellowish discharge from the external OS. It usually indicates infection with chlamydia or gonorrhea. However, these STIs may also occur with no visible signs, although the discharge may change the cervical pH. Next is the cancer of the cervix. Hardened ulcer is usually the first indication of cervical cancer, but it may not be visible on the ectocervix. In the later stages, the lesions may develop into a large cauliflower-like growth. A pap smear is essential for diagnosis. Next is the abnormal findings of the vaginitis. So, in assessing female genitalia, the nurse may suspect vaginal infection from signs such as redness or lack of color, unusual discharge, and secretion, reported itching, and other typical symptoms of the kinds of vaginitis discussed here. First is the candidal vaginitis, the moniliasis. So this infection is caused by the overgrowth of yeast in the vagina. It causes a thick, white, cheesy discharge. The labia may be inflamed and swollen. The vaginal mucosa may be reddened and typically contains patches of the discharge. This infection contains intense itching and discomfort. Next is the atrophic vaginitis. So, atrophic vaginitis, it occurs after menopause when estrogen production is low. The discharge produced may be blood-tinged and is usually minimal. The labia and the vaginal mucosa appear atrophic. The vaginal mucosa is typically pale, dry, and contain areas of abrasion that bleed easily. Atrophic vaginis causes itching, burning, dryness, and painful urination. Next abnormal findings is the uterine enlargement. So, uterine fibroids or the myomas. Uterine fibroid tumors are common and benign. They are irregular, firm nodules that are continuous with the uterine surface. They may occur as one or many and may grow quite large. The uterus will be regularly enlarged, firm, and mobile. Next abnormal findings is the adnexal masses, the ovarian cysts. So, ovarian cysts are benign masses on the ovary. They are usually smooth, mobile, round, compressible, and non-tender.